Ever since the day that you went away, you've been sending flowers, flowers to me, flowers today, flowers today.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
My name is Taufik Sultan.
I am Naufal Agniya.
My name is Neng Azzahra.
Student of English Education Department 2019 from Class 2B, UIN Sunan Gunung Jati, Bandung.
I want to talk about statement from Dr. Hans. Thank you for joining us once again for over 100 we have battling COVID-19 around the world. The impact of this virus has darkened all your life. My throat and deepest my sympathy are with those grieving from the loss of loved ones or who are anxiously ill themselves. And any step to ease restriction and transition must ensure, and one, that evidence show COVID-19 transmission is controlled. 2. That the public health and health system capacity, including hospitals, are in place to identify, isolate, trace contact, and quarantine them. 3. That outbreak risks are minimized in high vulnerability settings, particularly in elderly homes, mental health facility, and people staying in crowded places. And number 4, that workplace preventive measures are established with physical distancing and washing facility respiratory etiquette in place. That importation risks can be managed and that communities have a voice of are engaged in transition. And now, more than ever, I call from solidarity between countries. It is the time to set up and display both responsible leadership to steer us through this storm.
In the past 10 days, the number of cases reported in Europe has nearly doubled to close to 1 million. As we consider transition, we must acknowledge there are no quick wins. Any step to ease restrictions and transition must ensure that evidence shows COVID-19 transmission is controlled, that public health and health system capacities, including hospitals, are in place to identify, isolate, test, trace contact, and quarantine them. That workplace preventive measures are established with physical distancing, hand washing facilities, respiratory etiquette in place. That importation risk can be managed, and the last one, that communities have a voice and are engaged in the transition. COVID-19 is unforgiving and has the ability to overwhelm even the strongest of health systems in Europe quickly. Any steps to transition towards a new normal must be guided by public health principles, together with economic and societal considerations. We learn better together.
Case numbers across the region continue to climb. In the past 10 days, the number of cases reported in Europe has nearly doubled to close to 1 million. It is imperative that we don't let down our guard, but physical distancing, lockdowns, and other measures to slow down and stop transmission are affecting lives and livelihoods. Ultimately, the behavior of each of us will determine the behavior of the virus. This will take perseverance and patience. There is no fast track back to normal. Any step to ease restriction and transition must ensure 1. That evidence show COVID-19 transmission is controlled. 2. That public health and health system capacities, including hospital, are in place to identify, isolate, test, trace contacts, and quarantine them. 3. That outbreak risks are minimized in high vulnerability settings, particularly in elderly homes, mental health facilities, and people residing in crowded places. 4. That workplace preventive measures are established with physical distancing, hand washing facilities, respiratory etiquette in place. 5. That importation risk can be managed. 6. That communities have a voice and are engaged in the transition. Any steps to transition toward a new normal must be guided by public health principles together with economic and societal consideration.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.